Hi, my name's Dr. Ross Hauser. You're at Caring Medical's Florida clinic. I'm here with an old client of mine, Jessica from Greenville. So appreciate you allowing me to interview you before your treatment. I get asked a lot of questions about pregnancy, and then there's gals who don't realize that even if they get pregnant, you can get prolotherapy through pregnancy, because that's how safe the substances are that we use in prolotherapy. But also I get asked questions about, well, what if I get treated, and how am I going to be with pregnancy and after pregnancy? And it's been incredible how well the gals have done after prolotherapy with their pregnancy. So we knew each other a few years ago, and you got a few treatments for your lower back. Mm-hmm. And you had said that your previous pregnancies you had pain, you got some prolotherapy. And the reason that you stopped your prolotherapy 2 or 3 years ago is because you got pregnant. So what
Correct.
happened after that?
So we found out we were pregnant with our third child, and I get great anxiety just traveling. So I had opted to not continue the prolotherapy, since traveling from Greenville to here was just very stressful for me. I was hesitant because I didn't want the 3 treatments we had done up to that point, kind of go for nothing. But I got through my pregnancy, and I will say it is the best. My back didn't bother me once during my pregnancy. It's the best pregnancy I've had out of the 3 total that I've had where I've not experienced any back pain.
Oh, that's awesome. And then, so you could definitely say to gals, the prolotherapy held basically during pregnancy. And then you said it was kind of good. It was time to get back after the baby was weaned,
Yep.
get back to training. You love running, and
Yep.
that's kind of what led to why you're here today.
Yeah, so we had from the beginning had assumed that I would need about 5 treatments. So I knew at some point I was going to come back, but my back was feeling so good. It was kind of out of sight, out of mind. Started training for a race, and then I started noticing things started to regress a little bit. But it's been 2 years, I think, since I've had it. So whereas my pain is nowhere close to when we started 2 years ago, I did notice it going backwards a little bit, which brought me here today.
And congratulations, though.
Thank
you
you.
did complete your race. Why don't you tell us about that?
I did. I completed my half marathon. My goal was 1 hour 50, and I ran it in 1 hour 50 and 1 second. So as a race right after a pregnancy, I feel that's pretty good.
That's amazing.
Just across the finish line, I was always thankful just to do that. But ran the race, and my training was really good. Having just time to myself was always appreciated with 3 kids. But yeah, I'm finished, and
Just as that's kind of our goal then, is that our goal here is to just get you back to running? Is
yeah,
that kind
so
of the goal?
running is definitely
Okay.
my hobby. Doing races, we love traveling all over the U.S. to do races. My husband and I, my husband doesn't really run, but for me anyway, so running and being able to run without pain is really kind of the end goal.
Okay.
And then
Right.
keeping up with three kids under the age of 6.
Awesome.
So,
Thank
yeah.
you for letting us talk to you today.
Thank you.